Hi, thank you for stopping by. My name is Scott Ead, and you are here because you clicked the Medicare button, new to Medicare or Medicare enrollment. So, we are a company that is not affiliated with anything to do with Medicare or any government entity. We are individual Medicare advisors, and our agency, Green Mountain Insurance, and our websites, Plan for Tomorrow and the planforseniors.com, are independent. So there's no cost or any obligation for anything we do for you. We're a company that offers enrollment information, how to enroll in Medicare, understanding Medicare. We do education classes, and we also can help you enroll in the right plan and understand how Medicare supplements, Medicare Advantage programs, and the Part D prescription drug programs operate. So, not a problem. We can be as involved as what you would like, and there's no cost or obligation. We're happy to help you. If it's just understanding Medicare, that's fine too. So, what we would go over, if you at the very basic, we will help you understand how Part A and Part B of Medicare, which are called original Medicare, operate. And some of the basics of that are that we would go over Part A and how that is hospital insurance, understanding the cost for deductibles, how that works, and any out-of-pocket expenses for room and board. Hospital insurance under Part A is, think of it as all inpatient. You're in the hospital, you're admitted. The word admitted, not outpatient. Anything that happens in the walls of the hospital, that would be the room and board, that would be the operating rooms, that would be anything that happens within the hospital that is not doctors or medical equipment. Okay, that's how that's built. And generally, for most people, hospital Part A is no cost. That would be the case if you worked 10 years in the US and also paid tax. So in the US. So you would likely qualify for no cost Part A. And most people at age 65 are on Part A of Medicare the month that they are turning 65. So if I had a May 30th birthday, I would be May 1st. Okay, automatic. If I met that criteria and I worked and I qualify, you would automatically be enrolled in Part A. Even if you were working, you're likely enrolled in Part A. Some people aren't, but most are. Okay, so the second part of that, the original portion, Part A, and now the second part is Part B. That is all medical expenses. That is the health insurance component. That is the doctors that you see, your primary doctor, your orthopedic surgeons, your anybody else, your durable medical equipment, whether it's your crutches, your walkers, your oxygen. That's all billed under Part B. That would be anything outpatient in the hospital. So, if you're on an outpatient basis, you are being billed completely under Part B. Okay. So the important thing to know about that in Part A and Part B is that there's a lot of deductibles. There's co-pays. There's, Medicare only covers 80% of a bill if you're under Part B, if you're in surgery. So that can be very expensive. If you have a $50,000 surgery, it can be very expensive out of pocket if you're responsible for 20% of the doctor's bill. Okay. That's where most people have one of two things. They likely have a Medicare supplement or Medicare gap plan. It's the same thing. They two different words, but it's really a Medicare supplement. And this is a private insurance plan that you enroll in that covers what Medicare allowed but did not pay. And so Medicare basically pays its portion, the supplement picks up its portion. And at the end of the day, if you're on the right supplement plan, you'll pay very little out of pocket, but you will have a premium. A lot of people like Medicare supplements because it is, first off, it's available anywhere in the country. Do you accept Medicare? Yes, here's my Medicare card. Here's my supplement card. Okay. And there's a comfort in knowing that you pay a premium, just like you do for your auto insurance or homeowners insurance, and you know what your out-of-pocket expense is going to be. Likely you'll be on a plan that has a very low deductible, say $203. You'll pay a small or hopefully a reasonable premium for a supplement, but you'll know what your cost is. Okay, there's a comfort in that for a lot of people. And also, you're not limited with networks. Again, all the doctor has to say is, I accept Medicare. You can use that particular doctor. And a lot of people go that route. That is the most common way. Okay. Now, Medicare Part A and Part B and also supplement do not cover prescription drugs. So you also would need a Part D prescription drug program. These are generally fairly inexpensive programs, but they cover anything that you would get on a regular basis at the pharmacy, okay? Or most everything, okay? Not everything, but most. So you go into the pharmacy, you go into Walmart, or you go into someplace and you would hand them your Part D program, not your supplement, not your Medicare card, and that would be your coverage. And it could be an entirely different company. I could have XYZ company for my supplement, XYZ company or PDQ company for a Part D program. And then you would have a copay likely, or no copay if it's generic. Many of those plans have no cost generics. Many of them have online or over the phone programs that are very attractive. So if you have a supplement, you're going to have your Medicare Part A and Part B card. That's one card. You're going to have a supplement card, and likely you'll have a Part D prescription drug program. So you really only have three cards. Part A and Part B card are one card. Your supplement card's one, and then your prescription drug program. Now, you might be interested in a Medicare Advantage program. Now, Medicare Advantage programs are tricky. I know a lot of people like them, but a lot of people don't understand them. And when they do understand them, they wish that they had learned more about them before they had claims on them. It's important to note that those are great programs in some states. In many states, there could be thousands of dollars out of pocket. And yes, they might give you the little fringe benefits of having dental or vision hooked to it. And those are generally limited plans. Might even have a gym membership hooked to it. They might even have a Part D prescription drug program built into that plan. But you have to understand that those premiums, which are low or no premium, generally have a cost associated. And that would be if you're unhealthy. So if you're healthy, most people like those programs. But the minute you're unhealthy, you can start ticking up in cost, and it can be extensive. And you can't just readily jump off those plans. Supplements, I can change you any time of the year. All right, supplements are not subject to any annual election period or annual open enrollment period. Supplements we can change you. Medicare Advantage program, you can change once or twice a year. That's it. Okay, and unless you have in the election, a special election situation where maybe you lost coverage or whatever it might be, or maybe got bounced off of Medicaid or something like that. But that depends. Or if you came in, you were coming out for group health insurance, you can enroll that. So it's important to note these plans and how they work and the penalties if you don't have them and the cost out of pocket and what the best option is. That's where we come in. So we can help you from just a basic understanding of Medicare with a webinar, individual phone call, or individual Zoom, or possibly meet with you depending on where you are. We're here from the day you start to the day you disenroll, okay, from Medicare. So one way or the other. So we're here, and you can deal with myself, Scott Eade, or my wife, Heather Foskate, or any of our agents. So, I mean, we'll pick up the phone just like anybody else. You can call me directly. My number's at the bottom of the screen on the site, direct phone number for Scott. So feel free to. No cost or obligation, and happy to help. On the bottom of the screen is some information as to what your situation is, whether you're neutral, you're turning 65 and entering Medicare, whether you're coming off group health insurance and now, and you're over 65 likely, but now entering Medicare, and or whether you just want to have participate in one of our free webinars, not a problem, about Medicare education, how Medicare works. Okay, we do not go over particular plan companies. We just go over how actual Medicare works and the associated health plans, how they generally work. So we can become as involved as what you'd like and are happy to help you. So again, my name is Scott Eade. I'm the owner of Green Mountain Insurance, and I'm happy to help you. Thanks for stopping by. Bye.